Ladies, don't ignore these 5 warning signs. Cervical cancer is one of the most preventable cancers. What is cervical cancer? What causes it? The major cause of cervical cancer is persistent infection with high-risk types of human papillomavirus infection. Cervical cancer develops in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is one of the most common cancers affecting women worldwide, yet it is also one of the most preventable and treatable, especially when detected early. Regular screening and awareness of early symptoms can save lives. Here are 5 warning signs women should never ignore. What is HPV? HPV, human papillomavirus, is the most common sexually transmitted virus and, depending on the strain, can lead to cancers or warts. There are 2 strains of HPV. High-risk strains type 16 and 18 that cause cervical, penile, anal cancers. Low-risk strains type 6 and 8 that cause genital warts. HPV spreads primarily through sexual contact, including vaginal, anal, or oral sex. 1. Abnormal vaginal bleeding. Unexpected bleeding is one of the most common early signs of cervical cancer. This includes bleeding between periods, after sexual intercourse, or after menopause. Any unusual bleeding pattern should be promptly discussed with a healthcare provider. What increases your risk of cervical cancer? Some factors increase your risk of developing cervical cancer. They include persistent HPV infection, early onset of sexual activity, having multiple sexual partners, smoking, long-term use of oral contraceptives, weakened immune system, poor hygiene, lack of regular pap smear or HPV screenings. 2. Unusual vaginal discharge. A change in vaginal discharge, especially if it becomes watery, has a foul smell, or appears tinged with blood, can indicate cervical cell changes or infection. Persistent discharge that seems unusual for you warrants a medical checkup. 3. Pelvic or lower back pain. Chronic pain in the lower abdomen or pelvis that is not linked to menstruation may be a warning sign. This pain might also radiate to the lower back or legs, signaling that the disease could be progressing. For a pain during intercourse, discomfort or pain during sex can be an early symptom of cervical cancer. This happens when cancerous growths irritate the tissues of the cervix or surrounding areas. Do not ignore this symptom, as early diagnosis can make treatment more effective. 5. Difficulty urinating or bowel changes. As cervical cancer advances, it may press on nearby organs, causing trouble urinating, frequent urination, or constipation. These symptoms should be evaluated immediately. Prevention and early detection. Cervical cancer can often be prevented. Conclusion? Ladies, your body often gives early warning signs. Listen to them. Regular checkups and prompt attention to unusual symptoms can make all the difference. Cervical cancer is preventable, treatable, and beatable when detected early.